Okay, good evening, friends. Can we have the mics muted, please? Your mics are loud, so I request everyone except Dr. James to mute their mics. Yeah. Okay, friends, today on behalf of NMBF Church, I want to welcome you all and for this very exclusive session, special session on healthcare during COVID-19 times. And truly, for a lot of us, these are unprecedented times. It has really tested our faith. It has really tested us, our patience, our courage, our strength in every way. And truly the Lord has sustained us, and I believe some of us have lost our loved ones too. And this is truly a time for us to contemplate in prayer, but also equip ourselves with knowledge and resources that are available in the body of Christ. And so I want to really praise God for we have such a wonderful resource person, a richly resource person, Dr. James Thomas, who has been the former Vice-Chancellor of D.Y.Patil University. He's an outstanding heart surgeon, having performed over 16,000 surgeries. And he is with us. It is truly the grace of God that he's joined us today. A wonderful person that the Lord has placed in this vineyard in the body of Christ to help us, to guide us, to show us the way. So we really want to welcome Dr. James Thomas. So he will be leading us with a lecture in the beginning, and then afterwards we will have an open interactive session where we can ask him whatever questions we have. Okay, so I'm just putting Dr. James Thomas on the spotlight now. Yes, Dr. James Thomas, welcome. We are so glad you are here. Thank you so much for giving your precious time to us.
Yeah.
You are free to begin.
Yeah, Pastor, why did you pray? Oh, just
okay. Pastor Joe's already prayed in the beginning.
Okay.
But we can just say a short. We can say a short prayer here. Lord Heavenly Father, we thank you so much for this wonderful time. Thank you for bringing Dr. James Thomas in the midst of us, Lord, to really lead us and guide us and show us the way to survive in these very, very difficult times, Lord. Thank you so much that you have placed such a wonderful person, a hardworking person, an exalted person in the midst of us, Lord, to guide your people, Lord. And we really give you thanks for his life. Thank you, Lord, for all the glory and honor, Lord, that you have bestowed upon him, Lord, which truly is something that brings you back all the glory and honor. And we want to commit Dr. James Thomas in your hands. May you bless him and anoint him to lead us and share wisdom that you have blessed him with, Lord. We commit this time into your hands. In your precious name we pray. Amen. Yes.
Thank you. Amen. Thank you, Pastor Abhijit. Can you hear me now?
Yes, we can hear you loud and clear.
We would I like to thank you for asking me to speak this evening. Also, I bring greetings to all your church members and friends and other friends who would be joining us on this occasion. These are difficult times and unusual times of pandemic which has been spreading all over the world. And many people are not very sure the origin and whatnot, how this has spread so fast. But we have also seen in biblical times many pandemics and plagues and many other things had affected groups of people. The Lord
yes,
have been saved by these plagues too. Now, COVID-19 is affected by a virus, the coronavirus, which has been detected in 19. That's where the name has come, and the disease is called the COVID-19 disease. And all over the world, people are grasping how to deal with this, how to take care of their people, how to continue to take people who have, the difficult, the fibrosis of the lungs and many other diseases which follow the COVID even after treatment. Worldwide, more than 324 lakhs of people are affected. Out of this, maybe 9 lakhs, almost 10 lakhs people would have died by now. In India, we have almost 56 lakhs of people affected, and 92,000 is the mortality, or the people who have died. And one of the good things about the whole thing is that 90% of the people recover so fast, and many good recoveries are there. Only 2% or less than that is the death rate in many countries, and we are grateful for that. While the USA has more than 75 lakhs, Russia has hardly very little numbers and have been recorded, etc. Now, how do we identify this problem? Probably it is. We are all thinking it started in Busan, in China, etc., spread by traveling, and people moved out here, and the whole people got spread out. We are all now aware of what are the symptoms of this problem. The fever, you can have body aches, sore throats, maybe muscle pains, headaches, and cough. Some of these symptoms may point out to a viral infection. One of the ways to identify it is probably looking at the chest X-ray, which may show white patches in the peripheries. The blood test would probably show lymphocytes, which is the white blood cells in the blood has got the neutrophils and the lymphocytes. Lymphocytes are normally 24%, but in viral and in COVID infections, it can come down to as low as 6 or 10%. That's one way to identify. But the mainstay is probably the HRCT, that is the high resolution CT scan of the chest, which is done within 10 minutes. You can do this test in the radiology department, and it is a CT scan of the chest, which will show probably white marble plaques type shadows in the periphery of the lungs. And they classify that into almost 25, 6 out of 25, 2 out of 25, 1 out of 25 may not be insignificant. Up to 6, it may not be significant, but anything over 6, 10 out of 25, the shadows are significant. And the treatment pattern, and later 14 days or 21 days later, if you do this just CT X-ray, we will show how much resolution has happened. Of course, long-standing smoking and other things can damage your lungs and can produce a lot of fibrosis, and this can complicate these things further too. The mainstay, of course, is there's an antigen test which can be done by the nose, by your nose swab, and which can be available within an hour or so. But that will show only 25%, 30% correctness. And if it is positive, then you need to go for your full throat swab test. Throat swab test will probably give a very important positivity. Once that is positive, then that means the patient has a COVID thing. Now, if the symptoms are minimum, if you have only a mild fever, sore throat, etc., you may stay home even if you are positive. If your oxygen saturation is not required, it is not dropping. Now, oxygen saturation is something which you can check by a oximeter, which you can available from the medical store. You just put it on your finger. It will tell us the oxygen saturation in the blood, which should be 99, 98, 97. And if it's lower than that, 90, 92, or 85, you have a problem. And also it shows the pulse rate, which is a very important thing. Heart rate should be only around 72 or 82 or something. But sometimes these heart rates go up to 100 plus. So an oximeter is a good location to see. If you have more symptoms, you require your oxygen saturation has dropped to 85, 88, 90, etc. Then hospital admission is required, and maybe ICU admission may be required. We have in D.Y.Patil now almost 600 patients who are affected. They are on the COVID side. We have separate doctors looking after. We are on the cleaner side for heart and other things. And yet we have private wards which are also full of people. Many times they need to be shifted to the ICU when the oxygen saturation drops to 88 or 85. There are people become very breathless if the oxygen saturations are lower. Okay. So diagnosis by throat swab is the one, and also HRCT, which is the high resolution CT of the chest, and also the blood test, which shows. Then there are other tests called D-dimer, IL-6, and others, which will tell you the severity of the disease. Once diagnosis is done, we probably put them on what is initially a broad spectrum antibiotic. If the patient has sore throat and others, you can use what is known as azithromycin, 1 capsule a day for 5 days, and then vitamin C, 500 milligram. Paracetamol is the mainstay, which is crocin and other things, Dolo Neuro. All those can reduce your muscle pain, your headaches, and fever. And fever need to be kept down by use of these drugs. Once the positivity is there, if the lymphocytes are low and IL-6 is high, we put them on what is known as remdesivir, which is the injection, which is now available. This costs about 5,000, 3,000, around 3,000 now, I think. And 5 days you have to take these injections, and that is given by intravenous route. There is also other drug called Fabi-Flu, which is Favipiravir, which is 200 milligram, which can be taken 9 or 1 in the morning, 9 in the night, and then 4 and 4 in the next 14 days. So there is something called tocilizumab, which costs 40,000 for one injection, and maybe 4 or 5 injections may be required. In some cases, there is a storm and there's a high degree of saturation drop, and the patient is very sick. This is very rarely done, and there's a controversy, so we are not using those, but remdesivir is there. Now, I have myself admitted more than 10 patients right now under my private patients' nose. Some of them are on remdesivir, some of them are on Fabi-Flu, some of them have recovered and gone back, to wards and back home, etc. The personal hygiene is important. People should take care in these times that they have a bath every day, morning and evening probably. And also the throat, mouth cleanliness is important. After every meal, maybe you should brush your teeth and keep things. Otherwise, earaches and sinus infections and all are very common. People with comorbidities, diabetes is one, blood pressure is one, smoking and alcohol consumption of very high degree. All these can complicate the COVID infections. It is the diabetics and the hypertensives who have difficult times in these times because they are difficult to treat and they are easily succumbing into this disease. If you have been a smoker for many years, you need to cut down smoking, very important, because this leads to fibrosis of the lungs and the lung is not able to take care of these things. Diabetes, of course, need to be controlled by repeated sugar checking, as well as what is known as HbA1c, which is the 3-monthly average of the sugar in the blood test, which should be less than 7. 6 is normal, 7 is controlled. Whereas if you have many of our South Indian, Malayali and other patients, we have 11, 12, 13, 14, very, very high levels of sugar because of the particular type of diet they have and more consumption of carbohydrate, lack of exercise, etc. Blood pressure need to be controlled. Normal blood pressure is 120, but it should be kept below. Many of the patients who come 180, 200 is the blood pressure. That's very high. You can get a stroke, you can get bleeding in the brain, etc. So blood pressure need to be kept down to almost 140 level, systolic, and 90 diastolic. So these are some of the comorbidities which complicate the lung. Now, many people need ICU care. Who needs ICU? When your saturation drops below 90, 85, 88, etc., you're going to have problems. So they need to keep them on high level of oxygen flow, not only 20%, 40%, maybe 15 liters, etc. sometimes may have to be given. And there are special masks called NRV masks, non-repetitive masks. And some of them, if they do not respond, can be put on ventilators. Ventilators will give, help you to expand lungs with a high degree of oxygen levels. People who have recovered also can have oxygen in their home called the oxygen capacitor, which is available to rent for 6,000-7,000. And you can have a mask, and at home you can use oxygen levels also. So these are the levels now. Who is affected? Everybody. We used to think that's only older people above 60 are more prone, probably because of their less immunity, less lung power, etc. Maybe, but everybody, 40 to 60, large numbers people affected. Fortunately, young children are not affected because they have some resilience in the lung and they are not infected much, and small babies are not walking around with masks, etc. So what can we do? Prevention. The spread is by droplets, and so wearing a mask is a very, very useful thing to do. And the mask should be N95, which has got multi layers, and which you can filter the air, as well as what you breathe out also need to be filtered. And the masks with that with the what do you call valves, those are not good, because you take it in, there is a filter, but when you breathe out, there is no filtering there, and it's bad for the others. And frequent washing, because as you touch here and there, and your frequent washing of the faces, because you tend to touch your face, and that's how things can happen. There's a large fear about tabletops and lifts and other things. As far as possible, keep away, use your elbow to touch the buttons, etc. But it is not that much, probably, because people are thinking that is not the thing. It's more from the droplet, from the proximity of the person within 3 feet, 4 feet, or 5 feet. And using a mask is a good idea to prevent this. And now, if you have very little symptoms and you're positive, you can still stay home, take those medicines, whatever is required, but the person staying home should be isolated in a room and using a mask all the time, and others may have to be checked. There's a lot of paranoia in the society, and just because one person got it, close down the whole thing, close down people are being harassed for nothing. It is not required. And if there's a severity of the symptom, then you admit the patient and get them treated. Otherwise, they can stay home, isolated, etc. So these are some of the things which have come through, and ICMR and others are now looking at vaccines. Now, the Serum Institute in Pune is now coming out with a vaccine along with the Oxford units, and then there are a couple of others, Bharat Labs, and 2-3 vaccines may be available within 2-3 months, or maybe early 2021, and that is going to probably help 30 to 40% of the people who have not been affected, etc. Once you are affected, you can get antibodies within your body. That may be a little bit of strength, a little bit of building immunity. Now, how can we prevent this? How can we be careful? In any situation, it is always good to be careful and wash your hands frequently. Use the mask which is there, and also keep a social distancing, which has been already told in the lifts and in crowded places. It's not good to crowd into the marketplaces, and the shops and all are now slowly opening up. You have to be careful about that. When you are walking out in the park, etc., you may not use the mask, but if too many people are there, mask may be required. Otherwise, it may not be required. And if you are driving, you are the only driver, one mask may not be required. Cycles and others, if you're cycling alone, mask may not be required. But these are all, it is up to you to be judicious about the use of all these things. Now, many doctors, health workers, nurses, and they've all been affected. Now, when they are in the ICU, when they are in a positive ward, we have about 7-8 wards which are full of positive patients. So they need to be taken care of by these health workers. In India, more than 400 doctors have died of COVID because of their proximity while they were during the work. I'm sure hundreds of health workers, nurses, and others also have been affected. There is something called PPE, which is the use special gowns and masks for treating these patients who are in the difficult positive wards, and those can be taken care of. What can the government do? Municipalities supporting patients and they are trying to subsidize some of the patients in the government as well as in the private areas. Private hospitals are pitched in to give in beds. D.Y.Patil, we have 1,400 beds, out of that almost 1,000 working. Almost 600-700 are now occupied by COVID positive patients. So that's a big contribution to the society by the private network also. And let's keep health workers, in our prayer and support them. Don't, there are societies which are trying to get them out of the society just because they are going to the hospital to help poor patients. Just imagine if it's your own relative and there's nobody to look after. If that health worker has not gone to the hospital, who will look after that patient? So society people are sometimes, there's a frenzy, wrong thinking can sometimes create confusions. So we also need to be in a dignified manner, treat people who are already treated or positive or sick or some help that can be given from our side. We should be able to extend it to them also. And because one poor victim has been in a wrong place and wrong places, he got it. Just because you didn't get it doesn't mean that you are somebody very big. No, anyone can get this problem. And so let's be a little more humane in this situation, more dignified, and be more generous to help people, whichever way we can, and be receptive and obedient to the restrictions that are put. Lockdowns was probably one of the important things that has happened and that has helped us to control the situation. Britain now have gone back to second lockdown because people have irresponsibly started again roaming around the places, etc. European and other many countries are having strikes to take away the restrictions. Whatever, we still need to, because we don't know the numbers now. This is the thing. It may go on for a couple of months more. Some experts are predicting more than a year or more. Probably all this will happen till near normalcy can be achieved or seen. So I have tried to tell you what this thing is, how can be prevented a little bit, how can be part of it. If you have a family member who is affected, we need to take care of that, and medical help and that all need to be seen. Everybody doesn't have to be admitted to the hospital. One, everybody who doesn't need oxygen requirement, etc., need not go to the ICU. Everybody doesn't need ventilators. So these are some frenzies kicked up by the media, which is not required. And I think the government, the state and the national government, the government has done a good job in controlling this in our country. And we have large number of patients who may still be exposed more. That community transmission and all the other things are still going to happen. So maybe I've spoken enough. So we have any questions I can answer, or any other, if you have any comments to make, you can make. And Pastor Abhijit and the others can control this.
All right. Thank you so much, Doctor. This is the time we are opening the floor now for people to ask their question and queries. Anybody would like to ask, you can verbally ask, but please be mindful of others and just give each other the chance. So you can even text on the Zoom chat and ask your question if you wish to. Okay, the time is open now. Anybody wants to go ahead and ask questions here? Yeah, I think, Doctor, people are quite eager in the beginning to know about the medication to take if you are suffering from COVID, and the medication to take to build your immune system to prevent COVID. So can you just tell the names one more time? And, I could even note it down on the screen so people can see it. Yeah.
Initially,
azithromycin is for COVID affected people, is it?
Azithro, AZITHROMYCIN, erythromycin, azithromycin.
500, is it?
500 milligram, one tablet a day for 5 days.
Okay.
This is just an initial treatment if there is any sore throat or any other thing, people have. And taking vitamin C, 500 milligram every day is important for everybody.
Vitamin C, 500 milligrams.
500 milligram once a day for a couple of months.
Yeah, once a day for a couple of months.
Third is the paracetamol, which is crocin, which should be 500 milligram. Dolo, Neuro, there are different names for that. One twice a day, sometimes 3 times a day can be also be given.
So even if you don't have fever, Doctor, you can go ahead and keep taking this.
Only if you have fever, body ache, and sore throat, etc., then paracetamol is to be taken.
Okay, only in case of fever.
Yeah, because mild fever and thing all will subside with this paracetamol and vitamin C and other things. So initially, if you start off these in the beginning, it'll be good. And if you have no symptoms, of course, you don't take them.
Okay.
You should also take a multivitamin. Vitamins are important, which is any vitamin, Zinc-O-Vit or Zevit or whatever one thing. In India, the people are very low in vitamin D. Vitamin D levels should be at least 40, 40, and most of them are 10 and 15, etc. So vitamin D levels are better with maybe eggs, milk, glass of milk, 1 or 2 eggs every day is good. That old adage about yellow and all is gone. Now you take 2 eggs every day, and you can have nuts, you can have beans and other things which are high in vitamin D's.
Okay.
So these are some of the drugs initially, but once you are diagnosed with it, you need what is known as remdesivir, which is an injectable one, which is given to positive patients who are admitted in the hospital for 5 days. Remdesivir. REMDV. Don't get scared about the names, but 3,000 rupees and all that this costs injection per India.
Okay.
There is also what is known as now Fabi-Flu, FABI flu, which is Fabi-Flu is given for mild symptoms and moderate symptoms. People staying at home can take all these.
Okay. All right. So maybe doctor,
increasing your immunity is not overnight business. You have to be, what's called, personal sanitation, personal cleanliness important. Walking is important. I know people have not been walking for 5 months, but if possible, get out and walk in the society, outside society, park, etc. Some sort of exercise is good for building up immunity. And proper drugs and not overeating is very important. Most Indians are obese. We eat more than what we need. We eat a lot of carbohydrates and other things which is not required. Smoking is bad. Smoking is to be stopped. If we cannot stop, at least cut down and save your lungs.
Yes.
And also, alcohol consumption has to be very moderate, and probably this is also going to create more liver problems, etc., and which will affect your immunity.
Okay. All right. Okay. So okay. Any questions coming up so far? Anybody would like to ask any questions? Please go ahead. You can unmute your mic and ask, or put it on the chat, please.
Doctor,
yes, Pastor Jose.
Yes.
Use of lime water and warm lime in warm water. How does it help?
Yeah, there are a lot of Ayurvedic things and other things which people market it. We are not very sure what all that means, but plain water, warm water, these are all good for throat. Yeah, lime, you add lime, garlic, you add lime, something else, whatever you want to add, but frequent gargling may be helpful for your throat. Sometimes if you have a little irritation of the throat, this will help. But drinking enough water is also important. Dehydration is one of the causes of difficult time. 1 or 2 liters of water everybody should drink, 1.5 to 2 liters of water. So warm water gargling, warm water drinking, warm water people, lime, etc. Those are all, good enough. We have nothing to say about that much.
Okay.
And a person who has come approved by WHO, use of honey and pepper powder, I suppose. The WHO has approved it. Is this
for years together? All this were available, and a lot of people have been using that. Maybe use it. We don't know. Yeah. Allopathy has no role here in this. These are all just general stuff of keeping oneself alive. Yeah.
Correct. Yeah. Okay. Anyone?
How about walking? No, I want to ask, how many of you are doing some form of exercise? All are sitting home and eating and, doing nothing else, because, at least half an hour people should walk, do something. Now gyms are opening up, maybe go and do some exercises.
Yes.
Your blood pressure will come down, your sugars will get controlled, and eat also moderately. Now don't eat like my South Indian friends, 1 kg of rice, so 2 kgs rice every day, 3 times a day. This is not required. You can use a lot of vegetables. Vegetables have to be eaten. A lot of red meat is being consumed, which is not good for the body, which produces more of diabetes and blood pressure and all the stuff. So beef, mutton and all in lower consumption. Take more vegetables, maybe fish and other things may be more better. So food habits have to be moderated. some form of exercise have to be done. This will take care of most of the things, most of our difficulties, most of the heart problems, diabetes, and those who have all these too much is the one who are going to get affected by these plagues and flus and other things.
Yes. Yes, I believe somebody wanted to ask, one of the ladies wanted to ask something just now.
Yes,
go ahead.
Pastor. Yes.
Yeah, go ahead. Mrs. Thorat,
Good evening and thank you, sir. It was a very good and helpful information. Just one question. How far is it dangerous in case of heart patients?
Well, if you have a heart problem, you're adding on to the risk of the thing once you have to have an infection, because there's some amount of what is known as carditis. The heart muscle can get affected because of this COVID thing, and if you already have a weak heart failure, high blood pressure, etc., you need to get this checked up. Because of the fear of the fever, people have not gone to the hospital for checking up for the last 3-4 months. It is time to go to wherever there's a clean area where your checkup can be done. For example, we have a separate area, D wing, ground floor. We have separate X-ray, separate ECG, etc. for heart patients who doesn't go into the COVID area, which has got the things. So heart, diabetes, blood sugar checking, checking cholesterol, etc. All these things need to be checked out. And children and young adults with valves can also be valve problems. Narrowing and leaking of the valve can also have a problem with the COVID infection. So if your immunity is pretty good, it may not affect your body much as much as those who do not have as much immunity. And the lack of immunity is heart diseases, diabetes, all these diseases. But not to get unduly scared. Nobody is dying just like that, So, to try and take care, improve your system. Somebody said, who is your friend? Who is your best friend? Parents, children, spouses, somebody, nieces, and no. I think it's your body is your friend, because, you just need to treat that body more responsibly, a little more carefully, and not misuse it. We misuse, we abuse, we do all sorts of things to our bodies. The body is the temple of God. God has given us such a beautiful, good-looking people and whatever-looking people, whatever. Your body is good. So you have a responsibility to take care of yourself. Very important. And all the more so in a pan-endemic and endemic times. And we are very careless. We don't sleep enough. Oh, one more thing I forgot to tell was that people should sleep at least 6 to 8 hours every night. The South Indian culture of watching that idiot box till midnight, all their serials, and people don't sleep. You have to give the body time to recover. Minimum 8 hours of sleep is advised. At least 7 to 8 hours should be taken. And set up a time to sleep, 10:30, then get up at 6 o'clock. Something like that we must have. Otherwise, we tire our bodies. We have metabolites accumulating. Your diseases won't get controlled.
Doctor, there's a question in the chat box. Does juice of one lime work instead of vitamin C daily? Juice of lime.
Well,
does it work?
Brother, vitamin C is lime has got some vitamin C in that, but that's not the only one. There are many fruits which consumption of fruits is good enough. Yeah. And
can it be a substitute for the tablet?
No,
That's
what
they are asking.
I am not much of an Ayurvedic type.
Okay.
So that God-given fruits are all good. Eat some of them at least. Many people don't consume fruits, They only eat red meat.
What that person is asking is, instead of me buying tablets, can I be just drinking lemon juice every day?
Well, that won't be enough, I suppose. 500 milligrams of vitamin C, high levels are required at this time, at these times. And I don't know if we can even eat 20 limes for that. I don't know how much is required for that. We are not really sure.
Right. Okay.
Because we should not listen to irresponsible WhatsApps and irresponsible people. They, I took this and I got this done and all that. Be very careful, judicious and dignified in understanding that this, some of them are, only problem is, a lot of us are experts. We are all experts in all the medical things, and everybody's got their own way of misleading others.
Yeah.
We have to be a little careful in these things.
Right. Okay. Fine. Anyone else? Yes, go ahead, please.
Hello, Doctor.
Yes.
Good evening.
Yes.
Good evening. Doctor, I just want to ask you whether without checking, without checking COVID test, if we have got some signs and symptoms of COVID in our body, how
Yes.
without checking, how we will be confirmed whether we got the COVID or no?
No, there's no way of knowing without doing the test for sure. But if you have mild symptoms, little body ache, little fever, and other things, you do not rush to do the things yet. You can still wait and watch a few days, and take some, azithromycin, some vitamins and all that, and see how it is. Until we do the blood test, until we do the COVID test. Hello, can you hear?
Yes,
Yes,
Yeah.
yes.
Until we then, till then, we are not sure, whether you have got it or not. So mild things, you stay home and take care. And if it is not improving, then you go and get a test done. Chest X-ray, HRCT, series of tests are there which need to be done one step at a time.
Right.
Okay, thank you.
All right.
Thank you, doctor.
Yes.
Because if we have mild signs and symptoms, maybe this like a flu, it might have come and gone, and we will not be knowing also.
Yeah, this is also a viral infection. We don't know how it behaves.
Yeah.
Yes, many viral infections just come and go. But
Okay.
if the symptoms persist, you need to check yourself.
Okay. All right.
Okay,
Yeah.
okay, doctor. Thank you.
Thank you. Thank you.
Bless you.
Yeah. All right. Once you finish, please mute your mic. Yes. Anybody else wants to ask? Yeah. Okay. Doctor, there seems to be a popular conception that going to the hospital is very risky at these times. And so people want to be at home and try and treat themselves. So what would you want to say about that? Because there's this fear everywhere that if you go to the hospital, you might get infected.
It's not true, because now a lot of hospitals have got COVID patients. A lot of areas are taken up for COVID, but they are separated out. And there are clean areas. For example, in D.Y.Patil, we have a D wing, ground floor, which is a clean area where non-COVID patients have to come. All heart, neuro, this thing, all different OPDs are also opened up there. So once you have a clean area, it is not so. And the tests which are required for other things other than COVID, because just because you are talking about COVID doesn't mean that your diabetes, your hypertension, your liver disease, your other things are all gone. It is still there. That need to be checked. That need to be treated.
Right.
If otherwise it'll get bad. It'll get worse. Many people die 50% of the time because of other things rather than COVID.
Right.
The COVID is only an excuse or something which has happened. So there are clean areas for the hospitals, and where you don't have to worry about the COVID thing, and go and get yourself checked. And if you have diabetes, you have blood pressure, long standing, or other problems, please go to the clean areas and get them checked and treated. This is very important.
Okay. Thank you. Anyone else with questions, please ask immediately so we can use this time wisely. Anyone? And you can unmute your mic and ask on the chat box otherwise. Yes. Mrs. Ranganathan, go ahead, Mrs. Ranganathan.
Yeah. You know what? Nobody in my house allows me to go out of the house. And I cannot walk in the compound. We have a nice, I'm staying at St. Stephen's Church, Bandra.
Okay.
With the parish priest. I think you know Thomas Jacob, Reverend Thomas Jacob. So I'm his mother-in-law. They don't allow me to go out of the house. But I have a room upstairs on the first floor. So at least 5 times I go up and down. I mean, for breakfast. And is that enough?
Yes. Any activity is good. Whatever you can do within the house, outside the house, in the society area or in the park area. Now it is slowly opening up. You should be able to use those areas. And just sitting around for 2-3 months is dangerous, and some activity has to be there, for the body. So it's up to you. Look up for the clean areas. You can wear a mask and go to the society area and walk.
Because we have the watchman, we have the Mali coming from out.
Doesn't matter. So you have to be careful about your maids, your Malis, your paper wallets, everybody. They should not be allowed to come to the houses, or they should be restricted. because they usually roam around. These are the people who bring in the infection. So you have to be careful about all these.
Yeah.
And being older person, all the more reason that you should be a little more active, because youngsters probably will be working now. They are all started. People have started working, and older people are not get enough exercise and activity.
I wash a lot of vessels. I wash thrice a day at least.
Yes. Those are activities. You know, anything which you spend calories is activity, and that's good.
And she participates actively in Bible quiz also.
Very good.
Yeah. Okay. So thank you, Mrs. Raghunath. Okay. I just wanted to ask Doctor. Somebody's asked this question in the chat. Any advice on traveling? And is there any on traveling? When you travel, is there any advice on that? And is there any fact that children are less likely to have complication than adults for COVID-19? Two questions.
Well, traveling is a very complicated issue. Flights are not very sure how many you go. But a lot of people have gone to South, etc. I've seen them going on the flights and safely. Our parish priest, Saji, his brother was sick, cancer. He was gone to Trivandrum. Now, minimizing the traveling is very important. You can go by your own car, but all you need clearance. You know, when you land up somewhere else, there are restrictions of quarantine, etc. And within the city, as much as possible, we should not travel. But you see, there's enough traffic jam already in the roads, and you know, the shopping, etc., can be minimized, and only essential outings need to be done till we are able to get these things under control. Things are still not under control. It's going to be a few more months where people are going to get infected. So we need to be very, very careful. Right. You know, lockdowns and re-lockdowns, our government is trying to do many things, but the citizens have to be more responsible in this area.
Right. And the other question is about children.
Opening up the temples and churches and all that have to be very slowly done.
Yes.
I will not advise, you know, Kerala, they're going to start by 21. I don't know, some churches are going to be open, 100 people, etc., etc. We don't know, you know, so we need to be a little slow here, especially controlling people in these congregations would be difficult. I think it's more of Zoom meetings would be better.
Right. Doctor, the other question was, are children less likely to have complication than adults?
Yes, fortunately, thank God, a lot of children are spared. You know, we don't have many children who are affected because they themselves have some amount of immunity, and you know, they don't smoke and drink and all that stuff. I think children, but at the same time, we need to keep them protected from severe infections. And coming near anybody who's got severe infection, they should be kept away. And the schools and other things have to be very slowly started. Right. There's some move to have 9 to 12 standard students coming back to school and college also, but we don't know whether, you know, it has to be slowly implemented. Right now, everybody's all got used to this online education, and I think some more time it will take for us to decide on that. Yes.
Doctor, okay, anybody else wants to ask questions? Or we have questions lined up, few questions. Anybody wants to ask, this is your chance to unmute or put it on the chat. Yeah. Doctor, the entire, what do you say, the hyperness around, or whether it's true or to what extent it's true, about using objects and keeping surfaces clean. People want to sanitize their houses, and also they are bringing those electric box to sanitize your keys and wallet.
Yeah, you know, initially we thought that, you know, tabletops and furnitures and all are, but virus is not going to sit on that. Right. Now the latest study from Maryland University and others are saying that the spread is mostly by hand, by people touching their noses and faces all the time, and you know, and droplet infection. Right. And we don't believe that virus can stay on a tabletop or anywhere for hours together. Okay. That was the initial thinking, but that is not so. But a clean atmosphere within the house is important. You need to get your house cleaned up properly, maybe to some extent, but don't be hyper on that, because no need to unnecessarily vacuum clean and all expensive stuff that's not going to help. Only thing is social distancing, hand washing, as well as masks. These are the only three things which have been proven all over the world to do something good for this situation.
Yes, yes. Okay. Any question anyone wants to ask quickly before we close in few minutes? Yeah.
Yes.
Doctor, what is your understanding about the facility that has been put up by the state government in different locations? What is the standard of care over there as compared to other hospitals?
Yes. Maharashtra has had a large number of people affected, isn't it? Because of initially it was Bombay, then it was the peripheries like Dombivli, Thane, all those areas. Then now those areas are slowly getting controlled. Now peripheral people are coming into the cities, and that's increasing the numbers. So state government had a tough time probably to get controlling those migrants going from one place to the other. Initially was a issue, but that has now been sorted out slowly. So I think the government of India has initially, we were very early enough to starting that lockdown thing that has made a lot of success in controlling a lot of patients.
Correct.
And for those states which got a little late in starting has probably had more problem. But very surprisingly, Kerala and other places are now seeing more patients now. This is sort of a second wave is coming up.
Right.
Initially there was less, now there are a large number of patients in the thing. So government is trying to do what we can, but at the same time, private hospitals are also pitched in. They have used the facilities. For example, we have given out 700 beds, for these patients. They are all, half of them are from municipal, Nagarapalika people, and they are paying something to the private hospitals. I don't know from the money part of it, but then that will help. So they are trying to do things and also making these tests available, a cheaper level.
Right.
Now, medicines are also, the prices have come down. Initially, that remdesivir was 5,000, now it is 3,000, like that. So the more availability, that will help the patients also. Now, vaccine is the next big challenge. If the vaccines come up, they should be available in large numbers, and everybody should have it more. Every hospital should have it. Private hospital should have it, not only the government people, etc. So these are some of the issues which will need to be addressed as we come to that every time.
Right. Doctor, any information about what's your understanding about the testing part that has been put up by the government? Because in my interaction with people, clearly there are people out there who are having COVID signs, but they are nervous about going to these testing centers because they feel...
Testing centers are okay. They are all trained people, and whoever is doing the test, they have got trained technicians, so nothing to worry. All they do is they are also wearing a mask, they are a PP, and they ask you to open your mouth and then take that swab. That takes a few minutes. So that time they are also careful, and should be all right. Yeah, and you don't get any infection from those people.
All right.
So those are all standardized. Only the cost has to come down. The government has to subsidize these tests. That is the only thing. Because COVID tests will cost 2,200 in our hospital, which is probably high 1,800 or something, whatever. Now it's all come down. It was much more before. So that more people can use these facilities, and government should put up more kiosks where the testing can be done. The Delhi government has done a good job in getting the people away.
Yes, absolutely. What is the quarantine period for a person who's wanting to treat himself or herself at home, and would want to self-medicate using azithromycin and all these tablets? So what is the duration of
1 to 2 weeks? It is 14 days if it's
14 days.
If it is a proven positive case. If it's only a mild to moderate infections, 1 week would be probably enough. And then test again, check again,
All right. Okay. That would be the correct thing. Yeah. Okay. Any more question before we close in this time? Yes. There is also one query about when people are dying in these days, there is this huge concern about burying them and all that, and there are so many COVID cases also. So in many places, people are unwilling to give them the ground for burial also. So to what extent is this is it discriminatory or is it correct practice?
burial, cremation, etc. are a big challenge still, because hospitals should be able to, once a person is diagnosed and he has died of COVID, it has to be double packed, and different packing systems are there, plastic bags, etc. Which once they are properly packed, that is no more
Can be
danger
buried
there.
in the normal
People are only
graveyard.
worried. People are only worried by touching that will happen.
Oh.
And also there are now the undertakers and others who have been specially now trained to handle these matters. It will be good for us to just take their help in handling it from the hospital to the cemetery side, etc. And there are many people who we have used quite a few undertakers for taking the body, and they will take care of it, pack it, everything. Hospital will pack and they will repack or something and make it available for cremation or cemetery when the time has come, instead of taking it home. If it's a positive thing, it may not be advisable taking it home. It has to go probably directly to the cemetery. And it's a wrong thing to say that it has to be 14 feet and 7 feet, etc. Those are all not required if it's properly packed. And these are all just unnecessary anxiety and media productions.
Because the family goes through a further trauma of when they find so much discrimination.
And restricting the numbers. Restricting the numbers are also important, 20 or 50 or whatever now it is.
Correct.
And it's good enough. And yes. So that's a little difficult problem, but if you can afford, taking the help of an undertaker to handle the body is the best thing. They'll take away from the hospital. They'll keep it there. They will read it, and when you need it, they will bring it back to the place that's required.
Right. Okay. Doctor, just for the final time, I will display the PowerPoint once again, so that some of the main points that you mentioned are made quite clear. At least they are engraved in the minds of the people here. So azithromycin is
azithro, AZI.
Yeah. Okay, AZI. That's what I meant.
That's if you have mild fever, sore throat, and mild body ache, etc. You use that for 5 days.
Okay. Yes. So that's for 5 days. Vitamin C 500 mg once a day for a couple of months. Doctor, what about zinc tablets? Zinc.
That's Zingovit, Sevit, any multivitamin should be good.
Okay. Zinc also can be taken for a couple of months.
Yeah, that's why I mentioned Zingovit as multivitamin. Zingovit, Sevit, and there are good vitamins which has got enough zinc.
So Zingovit is different from multivitamin, doctor?
No, it's a multivitamin itself. That's got zinc in there.
Okay. So if you are taking Zingovit, there is no need to take an additional multivitamin.
No.
Okay. All right.
Paracetamol for fever, body ache, whatever.
Yeah, vitamin D can be consumed in tablet form, or
vitamin D is now it is available as Uprise, 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 which is to be taken 1 tablet once a week. Uprise vitamin D Uprise, 1 tablet only once a week.
1 tablet once a week.
Yeah, but you need to have your dietary supplements of vitamin D by eating. You can eat eggs, milk, nuts and other things which is good. Beans and etc.
Okay. And drink plenty of plain warm water. And and 1.5 liters of water minimum has to be drunk every day. And then walking.
Cut down smoking, alcohol.
Yes. I've written it at the bottom. Walking, proper drugs. Not overeating, smoking is bad, and alcohol consumption has to be completely cut off. That's what it is, right? And I think for this is the medication that FabiFlu and all will be given only in the hospitals, right?
No, the medication should be advised by the doctor. You should not
Okay. All right. So yes. So
everybody has understood everything. That's why there are no questions.
Right.
Or it has all gone overhead, somebody.
No, I think they have all become COVID experts by now.
Excuse me, doctor.
Yes,
doctor, just one more question. Doctor, what about Neurobion or Supradine?
So Neurobion has got a lot of B complex in that. It's good to use that one.
But then does that have zinc, doctor?
No, not necessarily.
No.
Not necessarily. B complex is good enough.
Okay.
Okay.
Thank you, doctor.
People who have recovered, what are the precautions for them?
Once you have recovered, you need to recheck within 14 days by a chest X-ray or an HRCT. Then you need to have a chest X-ray done, as well as, if possible, CBC, the blood test done, so that your lymphocyte levels have come up, and make sure that you are eating very well, and your diabetes, because this stress can also increase diabetes and blood pressure. So those areas need to be
Monitored.
taken care of, monitored. Yeah. So you check up again, and after 14 days or something. Hospitals are not the source of COVID infection, as people are worried. Yeah, there are clean areas. Yes, you go to the clean area, to the right doctor, and you get these things done. It will be fine.
Right. Okay. Any other question before we close?
I think it
All
can
right.
close.
Okay. All right.
Thank you for asking.
Yes, thank you so much,
there.
Doctor. God
Thank
bless
you
you
so much,
from all of us.
doctor.
We are
Yes,
so glad
God
you are
bless
there
you.
for us. Thank you
Yes.
so much. Yeah. Thank you everyone for attending. God bless you all. Bye.
Bye.
Thank you.
Thank you so much.
Thank you very
Bye.
much.
Take care. Thank you.
Bye.
Bye.
Bye.